I specialize in orthopedic physiotherapy. I am into this field from last 12 years. Today we are going to talk on a very interesting topic, regenerative orthopedics. We have Dr. J.S.Ranyal with us to enlighten us on this topic. Dr. J.S.Ranyal is an orthopedic surgeon. He has a vast experience of 30 years in this field. He has worked in India and abroad as well. So he has a very vast experience in orthopedic cases. Sir John Gurdon and Professor Yamanaka got the Nobel Prize for Medicine in year 2012. They done their work on stem cells. That Nobel Prize attracted the attention of the whole world on the stem cells. Today, Dr. j.s.ranyal will be telling us about the stem cells therapy. Dr. Ranyal, what is this regenerative orthopedics about?
Regenerative orthopedics is a very new concept in the treatment of various diseases. So far we were treating all the ailments with various medicines and antibiotics, or we were not able to treat some of them. But now we are in regenerative orthopedics trying to treat diseases by replacing the diseased cell with a healthy cell.
Dr. Ranyal, was this Nobel Prize the event which focused world's attention towards stem cells, or is it something going back to decades?
No, stem cell is a very old field. Actually, we have known for a long time, scholars have known for a long time, that there are certain organisms like starfish and lizards which can regrow their lost parts. And scientists have been thinking for a long time how it is done. But about 50 years ago, in Canada it was found out that there are certain cells in body called stem cells. When they get reactivated, they can form a whole part again. And Sir John Gurdon was the one who first gave the concept that we can use the nucleus of an old cell as a nucleus in a ovum and reproduce a whole new organism. Like, as you know, the dolly sheep, and after that pigs and buffaloes also came. They were based on that concept. But Sir Yamanaka, Professor Yamanaka actually, his field was that we knew so far that stem cells, all the life starts with the sperm of father and ovum of mother combining to form a zygote, and then this one cell divides into two, and the two divide into four, four divide into eight, so on and so forth, till you have a whole organism. Now these early cells are very powerful cells because they can form the whole body. So far we had this thinking that the old cells were the only cells which were powerful, but Professor Yamanaka, with his research, he showed that even the mature cells can be induced to go backwards, journey backwards, and develop the power of stem cells and form a new organism.
Dr. Ranyal, some people say there are some religious controversies on this issue.
Yes, there were some controversies actually. When stem cell research started, it was basically on embryonic stem cells. And because the stem cells were taken from embryos, then there were certain religious groups, especially the Catholics, who objected to it on the ground that for the sake of research, fetuses would be destroyed. And then at that time, President George Bush, he stopped this research. I think it was 2002, year 2002.
Yes.
From year 2002 to 2008, the research was kept stopped. It was only in 2008 when President Obama came into power, he allowed the research again, and then this field was.
So Dr. Ranyal, what you say, is it in still experimental stages or it is ready for the clinical use?
No, it is ready for clinical use, but experiments are still going on. But we cannot say that we are ready to treat every disease with stem cells. There are only a few diseases which are being treated with stem cells today.
Doctor sir, what is this platelet-rich plasma therapy? PRP.
Platelet-rich plasma therapy is, as you know, blood has many components. Among them, there are few cells. One of the cells found in blood is platelets. These platelets are coated with very rich proteins which are called growth factors. These growth factors have the capability to induce healing and formation of new tissue wherever they go. There are more than 100 growth factors. So what happens is that when platelets reach certain place, they release their growth factors, and these growth factors induce healing. In platelet-rich plasma therapy, we exploit this knowledge, and what we do is that blood is withdrawn from vein of a patient and it is centrifuged to concentrate the platelets. And once we have got concentrated platelets, they are injected into the part where we need them to cause accelerated healing.
What all diseases we can treat with this mode of treatment?
This is very good for problems in the knee, problems in the shoulder and in the ankle, because this basically is good for treating injuries to the ligaments and injured tendons, and these injuries are commonly found in the knee and shoulder and also in the ankle.
And Dr. Ranyal, what is this stem cell therapy about?
Stem cells, as we talked about the stem cells are basic cells which can divide into 200 specialized cells in the body. We know that adult human body has about 200 specialized cells. And stem cell has the capacity to keep on dividing limitlessly. And it also has a quality that it can specialize into any type of body cell. So to exploit this concept, what we can do is we can introduce this stem cell into the disease area, and gradually the stem cell will adopt the characteristics of that cell which is required there and induce healing.
Dr. Ranyal, please throw some light on the work of Sir John Gurdon and Professor Yamanaka.
So John Gurdon did a very basic work. What he did, the work was, it was considered that as the zygote grows, keep on dividing and becomes a full-grown organism, then the genetic material in the nucleus loses its vitality. But what he did was that he took the nucleus of a grown organism and inserted it back into a young cell through a pipette, micropipette. And then it was seen that he did it in frogs actually.
Okay.
Then this new cell, it actually kept on growing, became a tadpole and then a frog, which made us understand that the genetic information stored in a nucleus is not lost because it has grown and gone through various stages, but the genetic information is still stored.
Okay.
Professor Yamanaka, on the other hand, he did something in the reverse. So there is a difference of 40 years between these two scientists.
Okay.
Like what Professor Yamanaka did was very interesting. He thought that we can perhaps program this genetic material to behave like the early genetic material in a fetus.
Okay.
So he took skin cells, and these skin cells, the nucleus genetic material was reprogrammed and made to travel backwards and develop the capacity of a stem cell. Because if you see, then there is a zygote and it travels this way from zygote 1 cell to 2 to 4 to 8 to 16 till you have a whole body. And Professor Yamanaka's work induced this cell to travel backwards. From whole body, he took the cell, it traveled backwards and developed the capacities of a blastocyst.
And what all diseases can be treated with this stem cell therapy?
At the moment, lot of diseases can be treated, but one very common disease which is waiting to be treated by this and give benefit to the mankind is diabetes. Especially diabetes type 1, whereas there is deficiency of insulin producing cell. We know that in diabetes type 1, there is deficiency of beta cells in the islets or lamellins of pancreas.
Yes.
So this is a state of a cellular deficiency. So stem cells can be injected in the body, and the stem cells go into pancreas and they become insulin producing cells and cure diabetes forever, because now the patient will not have to take any medicine or insulin. But this is only for type 1.
Okay.
Type 2 is a different type of diabetes.
Dr. Ranyal, just tell us about the international scenario. Which countries are practicing this stem cell therapy?
You see what happened when the stem cell research and therapy started. It was more in United States, but due to the ban by George Bush, the research and the therapy was stopped, but kept on developing in other countries like Europe. In Europe, especially Germany is very well developed in stem cell therapy. And in the Far East, Japan is very well developed. In Japan, there are a lot of centers. Even in other countries like China and Philippines and Thailand are doing a lot of work. And in America, South America, Mexico, Brazil, they are doing a lot of work. It is very surprising that in the whole of the world, only India is the country where stem cell therapy has not become popular and not caught the imagination of the public.
So where in India it is available?
In India, primarily it is available, it became available in Chennai.
Okay.
Chennai, there is an institute called Nichin Regenerative Institute of Medicine, which was started in collaboration of a similar named institute in Japan. So from Japan, they transferred the technology and Chennai provided the brains, and this institute started doing work, and they are still doing a lot of work. They are providing BSc, MSc and even PhDs
Okay.
to students in this field. Yeah.
Okay, Dr. Ranyal, being an orthopedic surgeon, would you say it is a end of the surgery?
No, it is not end of the surgery. Surgery will continue. But of course, the indications will decrease.
Okay.
Like we can treat osteoarthritis of knee with stem cells and produce very good results. Because if you inject stem cells into the knee, not only the cartilage but also the meniscus and the ligament will regenerate. But still, we can only do this only in a knee which is not deformed. If the knee is deformed, it will have to go for total knee replacement.
And something from my field, what is the role of physiotherapy?
Physiotherapy is and remains important because a joint, if it has to be stable, then the joint is stabilized by ligaments and besides that by muscles.
Yes.
We can do nothing much for ligaments. That once a ligament is there, it is there. But muscle can be strengthened. And that is where the physiotherapy plays a good role. And the range of motion of a joint can be increased. So physiotherapists will also always keep playing the role of providing relief to the patient by increasing the strength of muscles and increasing the range of motion of a joint. So that physiotherapists will always be there, and we work together, and like physiotherapists are our partners in this field.
Yes. So doctor, what is the latest in stem cell therapy? What is the hope for disabling diseases patients?
People in various countries are doing works on different accounts. It depends. Like there are certain places where scientists are working on diabetes. On other side, there are people who are working on Parkinson's disease. Some people are treating stroke with stem cells. Some people are treating osteoarthritis with stem cells. But the latest thing is what is called 3D bioprinter. What is being done in 3D bioprinter is that this 3D bioprinter uses stem cells and not ink for its work. And it can actually print an organ or a tissue. So this technology is very interesting, and I hope that it will develop, and one day we'll be able to print at least some organs of the body using this 3D bioprinters.
That was a very enlightening session with Dr. J.S.Ranyal. Thank you, Dr. Sir.